I am a woman. I'm not needy, but I need love. I'm not weak, but I do need support. I choose a life, not an existence. Don't get me wrong, I'm not some selfish beast. I guess I just have the intuition to realize that if I have to keep everyone around me happy, I have to be happy first, So, I travel, I party, I work, I shop, I share, I nurture, I love, I live. And sometimes, all at the same time. But this is the life I choose.
I am a working professional. Balancing life at work and home has always been a tightrope walk. And then at such a point of time, I realized that I have fibroids in my uterus. It was traumatic.
Around 7 years back, I was diagnosed as having multiple fibroids, which were very small at that point, probably around 0.7 mm. And then over the period of 7 years, they've been increasing in size.
Then I remember those 4 years of my life, which really got my life to a halt. I mean, those were the days full of pain, trauma. I mean, it was full of bad experiences I had in my life.
I look back at those times and it just sends a shiver down my spine. There was a lot of constant bleeding during my menstrual cycles, and I put on a lot of weight, and there was a lot of mood swings that I encountered, and I also had a lot of shivering in my legs. I just didn't know how to handle the situation a lot of times.
Fibroids are the most common tumors which we come across in our gynec practice, and most of the time they come with bleeding problems or with a mass in the abdomen or backache or urinary symptoms. So many of the times because out of frustration they come to us, so we have to offer them a hysterectomy depending upon the age, or a myomectomy if they want to save the uterus.
I had gone to my gynecologist to find out about the various options that I could have, and one most obvious thing was a surgery, but surgery was definitely scary and I wasn't ready for it, and preparing myself for a surgery itself was quite difficult.
My body was changing constantly, and I just didn't know what to do, and with all that pain, the only option that I had was to go to my gynecologist. And then she diagnoses it as having fibroids in my uterus. And I asked her what the solution is, and she said surgery. I told her at that point of time that that was not something that I was ready for, and that I would rather take the pain than go for a surgery which would put my career to a halt. And I just wished there was an alternative that I could take.
These women sometimes go away and do not even come back for surgery or any treatment. There are some women who have medical conditions where anesthesia and surgery may not be very safe for them. In all these women, if we have an alternative to surgery where we can treat fibroids without surgery in a more non-invasive manner, it would be welcome. And I'm sure these women will be much happier to undergo this treatment.
One day I came to know about this new MRI guided HIFU technique, which was over the internet, and my gynecologist also explained to me the further implications of the procedure, that it didn't involve any scar or any anesthesia, and that I could be back on my feet immediately after the procedure.
I had read an article regarding this alternative procedure which didn't require a surgery, nothing invasive. But I was still skeptical, but anyway we just went ahead to check out this procedure and finally decided that this could be the most suitable thing for me.
For the treatment of uterine fibroids, MRI guided HIFU or MRI guided high intensity focused ultrasound is the latest breakthrough non-invasive technology. In this procedure, the patient lies on an MR table. High resolution MR images are generated. Ultrasound beam is focused on this fibroid, and you can see the fibroid being ablated. There is live feedback during the entire procedure, and the ablation is a volumetric ablation. The procedure usually takes 2 to 3 hours, and after the procedure is over, the patient can go back the very same day. This procedure is free of radiation and there are no scars.
So I underwent the procedure, and it was practically painless, and it was a procedure which lasted for 3 to 4 hours, and I was back on my feet immediately after the procedure.
So I opted to go for the procedure, and all it took me was just 3 to 4 hours, and I was back at work the next day, and I was attending all meetings, traveling on account of work, and it just felt wonderful to have all those problems gone and get back to normal life.
It was just 3 to 4 hour procedure, and then I was discharged from the hospital. Within 24 hours, I was back in my life again.
In the number of sessions that I've had in counseling our patients for uterine fibroids, I found them to be apprehensive about surgery, anesthesia, long recovery period, and also scarring on their abdomen. There have been at least 2 or 3 occasions when I have counseled unmarried females for HIFU, and this for them is much more acceptable as compared to surgery. I am sure that in the years to come, it will completely change the way we treat uterine fibroids in India.
When we look at tomorrow, whenever we want to develop technology or bring technology, we must have a technology which is like HIFU, an ultrasound guided management of benign tumors. HIFU is going to make a very significant difference for women who have got fibroids, who will have this treatment without radiation, without surgery. I think we should congratulate Philips for bringing this greater technology, newer adaptation for management of tumors, especially in young women.
Here's to life. To a life full of beauty and love. To a life less ordinary. To a life well lived. To a life uninterrupted.